Hello! Edutainment Studios and Access Healthcare welcome you to Irritable Bowel Syndrome, Getting Relief. This module is part 1 of a 3-part series on Irritable Bowel Syndrome, or IBS. Irritable bowel syndrome is a common disorder that affects the large intestine or colon. Irritable bowel syndrome, also known as IBS for short, commonly causes cramping, abdominal pain, bloating, gas, diarrhea, and constipation. IBS is a chronic condition that you will need to manage long-term. Only a small number of people with irritable bowel syndrome have severe signs and symptoms. Some people can control their symptoms by managing diet, lifestyle, and stress. Others will need medication and counseling. The objectives of this course are to help you understand the basics regarding irritable bowel syndrome, know what the symptoms of irritable bowel syndrome are, learn what the triggers of IBS are. Your colon is lined with layers of muscles that contract and relax in a gentle, steady rhythm to move food and waste through your intestines. In people who suffer from IBS, the muscles in the colon do not contract like they should. Strong or weak contractions in the intestines can cause IBS symptoms like cramping and bloating. When the muscles contract too slowly, you may have constipation. When the muscles move faster and with more force, you may have diarrhea. IBS symptoms are not the same for everyone. They may come and go, or they may be ongoing. When you are having symptoms, it is called a flare-up. The 3 main symptoms of IBS are abdominal pain, bloating, and discomfort. But other signs can include cramping in your abdomen, diarrhea or constipation, mucus in your stool, changes in how often you have bowel movements, changes in how your stool looks, and passing gas often. Always tell your doctor about any symptoms you have, including bleeding, which is never caused by IBS. Many digestive conditions share symptoms with IBS, so it is important to have your doctor rule out other possible causes. Remember, what you tell your doctor is key to shaping your treatment. If you have IBS, your digestive system reacts too strongly to triggers that do not bother most people. 1 or more triggers could include eating large meals, stress, menstrual cycle, and certain foods and drinks that include beverages like carbonated drinks, alcohol and coffee, fruits and vegetables like broccoli and cabbage, dairy products like milk and cheese, fried and fatty foods, chewing gum, chocolate, and some sweeteners. If you figure out what triggers your symptoms, you can get it under control. Keep a daily record and share it with your doctor. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 3-part series on irritable bowel syndrome, and come back for part 2.